Good morning. Today is Tuesday, November 15th, and today is anatomy scan day. I'm very excited. I know I said I was gonna give you all updates at like each week. I'm currently 19 weeks and 5 days. Last week we actually had our gender reveal, so I was busy planning and getting things together for family and friends to come over and actually having the gender reveal. By this time you would know that we are having a baby boy. So excited. This is definitely going to be a challenge for me, but not in a bad way. Like I've always took care of like baby cousins or my niece, and they were all females or all are females. And so this is like my first time I'm going to have the opportunity to care for a little boy from infancy, because normally my male cousins, they're about 2 or 3 by the time I start babysitting them and everything. So it's gonna be kind of different, but I'm excited for the challenge. I have to hurry up because I have to run a couple of errands before I go to my appointment. My appointment is at 1:30 this afternoon, but I want to give you all a rundown on what happened or what's happening right now in week 19. Let me show you what the baby is looking like as of right now. So week 19, baby is looking like this. Sorry for the lines, hopefully it doesn't distract. And let me turn it around for you. So now I can say he is doing marvelously. Right now he is currently 10.08 inches. Now of course this is estimate or average, and weighing about 10.58 ounces. Sleep patterns. Your baby will be developing more regular sleep patterns by now, and you may become aware of them. And I noticed that I can feel him moving around 3 or 4 o'clock p.m. while I'm at work, sitting at my desk, ready to go. And first thing in the morning, I can feel him as well moving around. And the movements are more like how you would feel like something like this moving around, as opposed to the little last time I think I updated you was like little small little taps, but now I can actually feel like little movements actually happening. If your baby is a boy, which he is, his testes will start descending into the scrotum. And at this point in your baby's development, most of the energy is utilized in gaining weight. So now he's starting to get some weight put on him. So that's what's going on right now. And currently, as far as size comparison, he is about the size of a mango. I've actually been updating that on my Instagram page. Make sure you're following me because you're getting a lot of real-time updates on my Instagram page. But every Thursday when I turn a new week, I've been updating and showing like a piece of fruit relative to whatever the size that he is approximate to. So every Thursday you can check out my Instagram story to see what piece of fruit that little baby is closest to, or our little boy. By the way, I'm not going to reveal any names until he is born, so don't even waste a breath. Now, if you want, you can give name suggestions just in case we think that your name might be a little bit better than the one that we've come up with, which I doubt it. But right now, we have a name. Just so you know, we're going with all B names for the boy, because right now we have Brandon and Braylon, Courtney and Cecilia for girls. So when and if we have a girl, her name will begin with a C, and boy, his name will begin with a B. So I'm just leave it at that. Okay, I'm going to give you all a bump update, and I'm going to be headed to the doctor for the anatomy scan. So I will bring you all with me. I'm probably not going to bring my camera. I'm just going to bring my phone and vlog on my phone, so that way I won't have to be worried about carrying too much equipment. But let me show you my bump update right now. Okay, this is bump right now, and yes, we are majorly bumping. Okay, so like I said, I'm probably gonna try to get a little bite to eat in these last 5 minutes, run my little errands, and then me and Brandon are going to meet so we can go to the doctor's appointment, and then we're going to have lunch. All right, you guys, I will see you at the doctor. All right, y'all, so I'm in the car on the way. My errands that I wanted to run ended up not happening, but either way, I'm on the way to the doctor's appointment, and I thought about something I wanted to share with you all. So basically, to prep before the anatomy scan, I didn't eat anything sweet. I ate like a little salmon cake that I made for dinner last night, and I'm only drinking water, and they're asking for you to drink I think about 16 ounces of water before the appointment. Evidently, having a full bladder pushes your uterus up and makes it easier for them to view everything in your uterus. So I have 2 bottles of water that I'm drinking on the way to the appointment, so that way everything can be right. I also brought my referral form from my actual doctor to go to the MFM, the maternal fetal medicine doctor. All right, if anything else comes up, I'll come back and let you all know. Hey guys, I'm back. I know I was supposed to come back and talk to you all after the anatomy scan, but Brandon and I went out to eat and we came home and just was chilling, enjoying the night, and then work got a hold of me. So I'm coming back to you all with an update for the anatomy scan and to let you all know what's going on for week 20. Today is Friday, so I actually turned 20 weeks yesterday. So let's get started. So first of all, the anatomy scan, I didn't go in as nervous as I usually am going into a doctor's appointment because I know I've been feeling him moving and everything. But I mean, of course, I was nervous because now this is the time where we find out everything about him, whether or not, you know, the size, if he's healthy, all the different organs and stuff or whatever. So everything was about 99% good. Basically, first of all, and I kind of battled whether or not I was going to share this with you all, but I'll get to why it's 99% and not 100%. First of all, we working with a big baby over here because on Tuesday I was 19 weeks and 5 days, but his legs, his femur, which is like the thigh bone, was measuring 21 weeks. Hold on, let me find the exact numbers. I don't want to lie to you all, so hold on one second. All right, so as I was saying, this appointment was with the MFM, the maternal fetal medicine doctor. And first things first, his fetal heart rate was 151 beats per minute. His femur was measuring 20 weeks and 2 days. So I guess that's how they're now going to start measuring the baby, is by the length of his femur as opposed to head to rump, because now he's longer. So the femur is measuring 20 weeks and 2 days. So I'm guessing he's like a week. Well, not a full week, because at the time, like I said, I was 19 weeks and 5 days. So 4 days ahead. And I think the last time he was measuring 13 weeks and we were 12 weeks and 4 days or something like that. So he's basically steadily being slightly, like about 4 days, 4 to 5 days larger than the gestational age. But what I was saying was, his legs, or his femur, was measuring, let me see if I can find it, 21 weeks and 3 days. His arms were measuring 20 weeks and 5 days. And like I said, I was only 19 weeks and 5 days. And on average, he should have been weighing 10 ounces. He's currently weighing 13 ounces. And he's in the 85th percentile. So we're working with a big baby, like I said. The doctor was like, well, hey, we might be having us a little athlete on the way. So, I mean, I ain't complaining. But, yeah, so that was all the great news. They monitor, I mean, they were able to look at everything. Like, we were able to see, I'll post a video up. It's not going to be long because they wouldn't let me record the entire exam, but she did let me record some stuff as she went over everything at the end of the exam. But she went through the brain, and we were able to see like a cross section of his entire body, his brain, his abdomen. We were able to look at his kidneys and look at the blood flow to make sure that we can see that blood flow is going to 2 kidneys. We were able to look at the blood flow within the heart, blood flow through the umbilical cord. We were able to look at the his stomach. We were able to confirm that there were 4 chambers to his heart. We looked at arms, legs. We were able to confirm that he is a boy. Because at first when we went in there, they were like, oh, we know you're gender blind. We're gender blind. And that means that we don't want to know the gender. But we were only hiding the gender until we had the gender reveal. And you all know we had the gender reveal on 11/11. So it's fine for us to know the gender now. And so they were able to confirm that we're having a boy. It was just so much information, and it was just beautiful to be able to see everything. Like, we were able to see his side profile, and he just looks so freaking cute. His cute little nose and lips and everything. And I'm just like, it's amazing. Like, I can't wait to see him. And then it was so funny because one of the times she was looking at something, and I said, oh, I need to know what's going on, because every time I feel him, I'm feeling him right at my belly button. At the time, which I think is probably the same, I don't know when he's going to actually maneuver, but basically his head is, he was face down, but his head is on my left side of my body, arms, and then feet is on the right side of my body. And I'm always feeling most of the movement right up under my belly button, which means that he's punching my belly button. And I was actually able to see that on the screen. It was just so fun. I was like, oh, that's what's going on. So he's punching me in my stomach. It's not even kicks, he's punching me. But it was just amazing to be able to see it and feel it all at the same time. I was actually hoping for that, and I was able to see it. I'm so, so happy. It was just an amazing experience. Brandon was happy. I was happy. It was like another sigh of relief, like to actually be able to feel normal and not have to feel so scared and you just don't know what's going to happen, and having to hold your breath, and I don't know, it just felt really, really good. Now, after all of that, that the sonography, or the sonographer did, she did all of the, you know, the pictures and videos of everything or whatever. Then after she left out, the doctor came in to explain the findings. And the doctor comes in and he says, everything is wonderful, everything is great, your baby is healthy. The only one thing that gave him some type of a concern, or would have been a concern, was there was like a small white dot in the sonogram from his heart. And I'm like, oh Lord, here we go, what is it? And I guess it would be a concern, or he was expressing that it would have been a concern if I had certain numbers to prove that I was in a higher chance of him having Down syndrome with the NIPT test. But with that NIPT test, that blood test, it showed that there was no factors that would cause him to have Down syndrome. So I'm guessing if you would have had a higher chance of having Down syndrome and had this white spot in the heart, then it would be more of a chance, or more of a I don't know what to call it. I just a chance of him having Down syndrome. But then the doctor was like, since that's not the case, that's not the issue as far as the blood test. There's nothing to worry about. It's very common for certain babies to have this little white speck. He was like a real small white dot. And I looked it up. I forgot exactly what the doctor called it. Oh, EIF. Let me Google and tell you. It says normal anatomic variant. EIF. I'm just going to put up on the screen what it stands for. Echogenic Intracardiac Focus. I believe that's how you pronounce it. Echogenic Intracardiac Focus. And basically, I think I read that it means like a little small piece of calcium in the heart. It says an echogenic focus on its own poses no health risk to the fetus, which that's our case. That was the only thing. There was no other factors that would show any type of issue. It says, and when baby is born, there are no risks to their to their health or their cardiac function as a result of an EIF. It is considered a variation of normal heart anatomy and is not associated with any short or long-term health problems. And then this also says, does EIF always mean Down syndrome? Could an EIF mean the baby has Down syndrome? Some studies raise concerns about a small risk for Down syndrome with this ultrasound finding. However, most studies do not find a higher risk for Down syndrome when an EIF is the only ultrasound finding. So that was the only ultrasound finding. So he reassured us that everything is fine. Of course, we're going to stay in prayer. Of course, they made my heart drop. I'm like, of course, you're going to come in and say everything is great, but nothing after a but is good. But he said that there's nothing to worry about. There's been research showing that there's nothing to worry about. So I'm going to stay prayerful and know that nothing is wrong. So that's basically how the anatomy scan went. He was telling me how, I asked him, was I considered high risk based off of my age, my weight, and then I don't know if I've actually shared this with you all, but it was found out during an ultrasound last year when I had to get the DNC that I actually have 2 small fibroids. They're not major, they're not in a position that will affect me getting pregnant or having a healthy pregnancy, but they are monitoring them because sometimes when you get pregnant, the hormones from your pregnancy feeds the fibroids, which causes them to get bigger, but they haven't gotten any drastically larger or anything like that. So I think with those factors, fibroids, age, because I'll be 35 by the time the baby is born, and my weight, I'm not really considered high risk, but he said I'm about moderate. So that's probably more of a reason why I had to see the MFM, the maternal fetal medicine doctor as well, and because I've also had a miscarriage in the past. So he was just telling me how, I guess just explaining to me why I was seeing him in the first place. I will go back to see him at week 32 and week 36, and I think he'll say each week after that, after I turn 36 weeks. I also asked him, because I actually was born of a C-section, a cesarean, and the reason why was because I was choking off of the umbilical cord. And I asked him, I said, I'm sure it's not anything genetic, but is there a way that they can see something like that beforehand? And he was just saying how the length of umbilical cords are genetic and it varies pregnancy to pregnancy, but they're able to see those type of things, and it wouldn't more so be about the length, it's more so about the pressure. If something is pressuring or putting pressure on the umbilical cord, then that would be a reason why I could possibly need to have a C-section, because there could be some type of risk to putting pressure on the umbilical cord, which of course would restrict food and blood flow and everything to and from the baby. So yeah, I believe that was it. Like I said, it was just an amazing experience because we were able to see him moving around, being very busy again, as he has been for all the other sonogram exams. It's just, she was like, Now you know what you're gonna have to expect when he's born. You're gonna have a busybody. I'm like, I'm not even surprised. I did realize I drank too much water. I think I told you all I had to prepare. They want you to drink water, enough water, so that way your bladder can kind of push your uterus up, and they can see everything clearly. But evidently I drank too much water, so she did like a little scan, got his heart rate, and then let me use the restroom so that way we can continue on with the exam, because I had drank too much water. What else? What are some other tips? I don't know. It was just an amazing experience. Like, I was just in awe and just so grateful and thankful for it all. I just, it's really, I really can't explain it. I really can't explain it other than just a beautiful and marvelous experience. I feel closer to him now. I feel like even more bond. We've been reading more. I kind of have an idea of when he's active, more so around like 10 o'clock in the morning and like between 2 and 5 p.m. I always feel him in a car ride coming home like I just did. I've been feeling him while I've been doing this video. I'm just ready to see him. Yeah. Okay, so yes, 20 weeks. I turned 20 weeks yesterday. So let me open up the app and show you all what's going on and tell you all what's going on at 20 weeks. So here we are. Let me get closer. He's got a little bigger. Here we are at 20 weeks. Nothing too much has changed really from last week, but I can read to you all what they're specifying. It says your baby's sex can now be identified on an ultrasound, which it was able to be confirmed that we're having a boy. Your baby may be busy sucking his thumb, yawning and kicking in your uterus. And hair is growing on your baby's head and facial features are formed. So that's what's going on right now, and currently he is the size of a cantaloupe. I'm just amazed. That's all I can say. Like, I have no other words. It's just beautiful. I actually go back to my OB next Tuesday. That might be with one of the midwives. Just a follow up and everything. So I think I'm still going to them once a month now. And like I said, I go to the MFM at 32 weeks, 36 weeks, and then I think he said each week after that. But I'll confirm exactly when I go back to the doctor next week. Okay, guys, let me know if you all have any questions about anything. I think I've given you all the information, give you all the updates of everything as far as weeks 19 and 20. I have to see when the next milestone will be, but I'll still be doing my pregnancy vlogs, giving you all updates on what's going on. So, we shall see. Thank you all so much. Okay, y'all, I got my sister on FaceTime right now, and that's what you hear. She was talking, but I said I had to come on and talk to y'all immediately. I thought I was done, but I ain't. We having a whole regular conversation, and I started feeling like, I guess my ab muscles starting to stretch again, like pressure being pushed out on my belly button from the inside. I had to sit down. I had to stop everything in the middle of what I was doing. Child, he pushing out. I feel the pain, like the ab tightening muscles being pushed. It ain't no joke. It ain't like, oh, excruciating pain, but it's like, I feel it. I feel the spirit moving.
Wait until month 9. That's when the fun begins.
Y'all hear her? Okay, well, I may or may not be done. We'll see. We'll see. Hey, fam. I am not feeling good today. I really don't know what's wrong. I've eaten twice today. I just feel kind of nauseous. I don't know what's going on. I have been feeling our little boy, not as much as I have been the past couple of days, but I have felt him. I kind of got nervous. I'm like, we know his name, so I've been calling him by his name. I don't know why. I need to fix the crop on this. Why is it so close? Am I zoomed out? Okay. I don't know. Anyway, I've been calling his name, talking to him and everything. So I felt him a little bit. I don't know if he's feeling that. I don't feel really good right now, but I feel kind of queasy. I don't know what that's about, but the work can't stop. I have another video or finish a vlog that I need to finish recording and then edit so I can have it ready for posting tomorrow. So I'm gonna maybe drink some water. I don't know. I hope I feel better. I will catch up with you all later. Hey, I'm back and feeling much better. I think the last time I talked to you all, I wasn't feeling really good. I had like a bout of nauseousness. First time since being in the second trimester. And I had like a headache. And I don't know, I was feeling off yesterday as well. So I didn't vlog. But today is a new day. It's a better day. I actually went to my OB today. I saw one of the midwives. Everything was good. This was the first appointment that they asked, how you doing? And I said, I feel great. Like, I really, literally, genuinely feel good. Like, no complaints, no major questions. Just enjoying pregnancy for the first time, for real. Totally. We talked about everything that was discussed at the MFM last week. She kind of gave me a little bit more, well, not really a little bit more in-depth explanation as to what was going on as far as the little white spot. But basically she was saying how before these blood tests came about, the only thing that the doctors really could go by were the ultrasounds. And like some time ago, if doctors saw that little white spot, there would be like a direct correlation between that white spot and a baby who may have Down syndrome or something like that. But so like before, they would, like, I guess women who don't usually have to take the NIPT test, they would take the sonogram or get the ultrasound or whatever. And if that is shown, then they would then refer them to take the NIPT test for more accurate results. Since I already took the test and got the accurate results, it was negative, then there's nothing to worry about. And she said, trust me, it's nothing to worry about. If they're saying it's nothing to worry about, the MFM is saying it's nothing to worry about, it's nothing to worry about. So, of course, I'm still going to have that in the back of my head, but it's nothing to worry about. So, it is what it is. She kept saying how she know that he was moving around extra as usual. She could hear his feet going back and forth through the Doppler machine. His his heartbeat or heart rate was 138 beats per minute. What else? That was really it. Like, I joked to my sister. I was like, other than hearing the heartbeat, like, we could have did this appointment over the phone. But I know they had to take my urine sample, take my blood pressure to make sure I don't have high blood pressure or anything like that. But that was really it. I set my next appointment for 4 weeks from now. And that's really it. We discussed how the MFM doctor said that I should wait maybe like 2 or 3 weeks before I get the pregnancy band, which is the band that's going to help keep the weight of my stomach off my uterus off of my hips, because I've been aching in the hip area. And when I spoke to her about that, she actually said she was going to refer me to my brain is physical therapy. And I just realized I walked out without getting the referral information. So I'm going to have to call back up there and see if they can email me something or fax me something, because I completely walked out, signed out without getting that referral. but she's gonna refer me to a physical therapist for my hips and stuff to help me with that. So I'm excited about that. Right now I'm sitting in the car waiting. I'm actually about to go look at the venue for the baby shower. I want to get an idea. I mean, I've been to this place before once, but I want to get a better idea of the layout. So I mean, of the layout, so that way I can know how I want to design and decorate for our baby shower that we're gonna have early in the year. So that's what I'm doing right now. I'm going to record it. I probably won't talk over it. I'll probably just record just so that way I can know what's what and you all can see it. But now I'm actually starting to think of whether I want to share it with you all until well, I probably will share it. It don't matter because you're not going to see how it's going to be designed until the actual baby shower. But I probably will show you all what the facility looks like. But yes, I'll see you inside. Hey fam, I don't even know what's the last update. I believe I may have given you all updates on the anatomy scan. That probably was the last thing. I'm actually currently 21 weeks and 2 days now. But this is probably gonna be the end of today's or this week's or this pregnancy update vlog. I do wanna let you all know that I don't know if I'm getting tired again or if it's just a lot going on between the gender reveal, planning and doing everything for Thanksgiving. It's currently Saturday, November 26th, and now I'm currently trying to, or I am in the middle of doing Christmas decorations. So I'm a little exhausted, but it is what it is. Once everything gets together and cleaned up and straightened up again, I don't have anything too much to plan for until the what is it called, the baby shower. I do want to do a video about the nursery. I have a whole plan as to how I want to go about doing it. I have everything saved. I know exactly what I want to get for the nursery, so that would be a separate video, of course. And then my birthday is coming up, but I'm just ready to just take a chill for a minute for pregnancy stuff. But I do want to give you all updates. I've had maybe like 2 or 3 days for the past week, had a lot of heartburn and acid reflux. Like last night, I did like a regular burp, but it was like a lot of acid that came up and I just was not feeling it. I didn't like it. It's nasty. So I'm like, okay, is baby boy gonna have a whole bunch of hair? I'm gonna take notes of all this stuff to see if all the different wives' tales and myths and everything are true. So we shall see. But yeah, I think that's gonna be it. Thank you all so much for sticking with us, sticking with me for this journey. I have been feeling him moving quite a lot, and it's crazy because when if I'm hungry and I know I need to eat and I'm about to eat, I can feel him rumbling around like, I know it's coming, I know it's coming. Like it's even before I even put food in my mouth, I can feel him like revving up to eat. But yeah, so those have been the updates lately. I don't think anything else is going on that's too significant. I had my OB appointment the other day on the 22nd, and the midwife just gave me a little synopsis of what was explained or what happened at the anatomy scan. Regular stuff, urine, blood pressure, and heartbeat. So yeah, I believe that's it for a while. If anything significant happens, like I said, I'll be back. But as of right now, things are just chill, and I'm not complaining because it has been quite eventful. All right, you guys, thank you so much, and I will see you on the next pregnancy vlog.